In this video, we'll be covering 3 topics: gluten-free foods, detoxes and cleanses, and supplements. I'll be providing a general overview. Please see the additional information tab in the course to find more information on these and other topics. The first topic is gluten-free foods. Those with celiac disease, which is a food allergy or autoimmune response to the protein gluten found in wheat, rye, and barley, absolutely should follow a gluten-free diet to maintain health. This condition, however, is fairly rare. Some other people may have gluten intolerance. Food intolerances are less serious, and they're not autoimmune responses, but they may result in some stomach distress, like gas or bloating. Or some people have reported mental fogginess from eating a lot of gluten. There is great information, yet again, on the USDA Food and Nutrition Information Center website on the diet. Be wary of gluten-free processed food products and always read the labels. Gluten gives bread and cakes their fluffy texture. So being gluten-free doesn't necessarily mean that products are healthier. In fact, these foods may have more sugar and fat than products without gluten to compensate for that texture difference. The next topic we'll cover is detoxes and cleanses. Detoxes and cleanses are claimed to pull toxins from your body. There is, however, no physiological basis that a detox drink or supplement can do this. Toxins in the blood are filtered out through your liver and kidneys. Drinking plenty of water, limiting caffeine, alcohol, excess sodium, and sugar, and getting plenty of fruits, vegetables, and whole grains, so basically just following a healthy diet, helps your organs function well and helps things move through your system. Along these lines, certain components of detoxes like lemon juice or plant-based foods have antioxidant properties that protect the body from damage done by free radicals. Without going into detail, free radicals are short in electron, and antioxidants can donate an electron, making the free radical stable and staying stable itself. This way, free radicals are unable to turn other atoms into free radicals, damaging cells which may contribute to cancer and heart disease. Free radicals are sometimes formed in the body during metabolism or come from pollution, herbicides or pesticides, or radiation. Most healthy foods are good sources of antioxidants, like vitamin C in fruits and vegetables, vitamin A and red, orange vegetables in particular, eggs, liver, and dairy, and vitamin E in nuts, seeds, vegetable, and fish oils, and whole grains. These same foods also tend to be anti-inflammatory. Inflammation has been linked to an increased risk of cancer, heart disease, diabetes, arthritis, depression, and Alzheimer's disease. Less than healthy foods like refined carbohydrates, processed meats, and fried foods contribute to inflammation. There is some evidence that skin conditions that result in inflammation, like eczema, may be triggered or helped by specific foods. There hasn't been much research so far, pretty preliminary, but probiotics, green tea, and plant and fish oils are currently being evaluated as helpful for those conditions. Detoxes may have some positive effects depending on how you do it, but juice cleanses in particular have some major issues. For instance, there is no evidence I could find that juice cleanses work, and they tend to be very high in sugar. Some juice cleanses sold online have between 70 to 200 grams of sugar a day, which is nearly 3 to 8 times the recommended daily amount of sugar. Juicing in general removes the fiber from the fruit and vegetable. One job of fiber is to slow the movement of sugar into your bloodstream. Without fiber, you can get sugar rushes and crashes as your blood sugar fluctuates. This is very dangerous for people with prediabetes or diabetes in particular. Cleansed teas often have senna in them, which is a natural laxative. This will help you go to the bathroom, but not more efficiently filter out toxins. The last topic that we'll cover is supplements. This is a large topic and can refer to many different things. You can look up specific questions on nutrition.gov. And before taking anything, please always discuss it with your doctor. There are 2 general types of supplements: vitamins and minerals, and then herbal supplements. Taking a multivitamin might be a good idea to fill in the gaps of your diet, if any exist, from poor diet, pregnancy, or being vegan, or other kind of conditions. Individual vitamins, however, can be a concern, since taking one can interfere with the absorption of another. For example, calcium can bind iron in the digestive system and prevent it from being absorbed. Zinc and copper use the same receptors in the gut to be absorbed, So taking lots of one or the other can flood your system and make it more difficult for the other to find an open receptor and be absorbed. Herbal supplements are things like teas, tinctures, and pills. Think of CoQ10, Dong Quai, or St. John's wort. There are many concerning drug-herb interactions, like St. John's wort can increase the effect of drugs with sedative effects, and black cohosh may enhance the liver toxicity of certain medications. Many people think that supplements are natural and harmless and won't mention them to their doctors, but it's very important that you do. Thank you for watching this video. I hope you learned a little something about gluten-free foods, detoxes and cleanses, and supplements.